Do you have a nagging ache that just won't go away? Maybe your stomach has felt off for a few weeks. Maybe you've been more tired than usual, even after a full night's sleep. Most of us write these things off as just part of getting older. And you know what? Most of the time, that's exactly what it is. Nothing to worry about. But there are a few specific patterns when certain signals show up together that are worth paying closer attention to. Not because you should be scared, because being informed is the best form of protection you have. I'm Dr. Sarah Mitchell, and today I want to walk you through 8 signals that, when they cluster together, deserve a real conversation with your doctor. I'm not here to alarm you. I'm here to help you understand your own body a little better, and to give you the exact words to use if you ever need to advocate for yourself at the doctor's office. Stick with me to the end, because signal number 5 is one almost nobody talks about, and I'll also give you a simple script you can use to make sure your doctor takes you seriously. Let's get into it. Signal 1, urine that keeps changing color. Most of us notice this and just drink more water. The color lightens up, we feel relieved, and we move on. That's usually exactly right. But here's something worth knowing. There's a connection between your pancreas and a small tube called the bile duct, which carries a substance that gives your urine its normal pale color. If something is pressing on that duct, your urine can turn darker, sometimes the color of tea or cola, and it can keep coming back even after you've had plenty of water. The detail worth watching for isn't one dark day. It's a pattern that keeps repeating for more than 2 weeks, no matter how hydrated you are. If that happens, it's worth mentioning to your doctor, not because something is definitely wrong, but because patterns deserve attention. Signal 2, upper belly pain that wraps to your back. A lot of us have back pain. It's common, and most of the time it really is just an old injury, arthritis, or muscle strain acting up. But there's a particular pattern worth knowing about. It usually starts as a dull ache in the upper abdomen, right below your breastbone, and it can spread around to the middle of your back, almost like a tight band. 3 details can help you tell it apart from ordinary back pain. It tends to get worse about 30 to 60 minutes after eating. It often feels worse when lying flat, and it doesn't respond the way typical muscle pain does to rest or a heating pad. If that sounds familiar, it's worth describing it exactly that way to your doctor. It's in my upper abdomen, it spreads to my back, and it's worse after meals and lying down. Specific descriptions like that help your doctor know what to look for. Signal 3, feeling full after just a few bites. You sit down to eat, a few bites in, and you're done. It's easy to chalk this up to, my appetite isn't what it used to be. Sometimes that's all it is. But if it's a new pattern, and especially if it comes with unplanned weight loss, losing more than about 5% of your body weight over 2 or 3 months without trying, that's worth flagging. Losing 10 or 15 pounds without changing anything about your diet is something to mention at your next appointment, not something to quietly accept. Signal 4, yellowing of the skin or eyes with itching. This one is visible, which actually makes it easier to catch. The whites of the eyes may take on a yellow tint, and skin can develop the same tone. In some cases, this shows up most clearly in the eyes and palms. It can also come with intense itching that doesn't respond to lotion. Here's the important part. This can look identical to jaundice caused by gallstones, which are very common and very treatable. That's exactly why it's worth giving your doctor the complete picture, rather than just one symptom. Mention the dark urine, the upper belly pain, the appetite changes, and the yellowing, all together. A fuller picture helps your doctor know whether a closer look is needed. Signal 5, an unexplained blood clot. This is the one most people have never connected to anything beyond the leg itself, and it's the one I really want you to remember. Sometimes certain conditions can change the way blood behaves, making it more likely to clot, often in the deep veins of the leg. The calf or thigh may swell, feel warm, and ache with a heavy pressure that doesn't ease with rest or elevation. If you ever notice sudden shortness of breath, sharp chest pain that worsens with breathing, and a racing heart all at once, that's an emergency. Call 911 right away. But even on its own, an unexplained clot, one with no recent surgery, no long flight, no clear cause, is worth asking your doctor about directly. A simple, calm question like, is there any reason to look further into this beyond just treating the clot, can open the door to a more thorough check. Signal 6, fevers that come and go. A fever on Tuesday that disappears, then returns on Thursday, often gets explained away as a bug going around. Most of the time, that's exactly what it is, a normal illness running its course. But a fever that keeps cycling for several weeks, especially low-grade and paired with night sweats, is a different pattern worth asking about. A recurring fever with no infection ever found is reasonable to bring up directly. This keeps coming back, and nothing seems to explain it. Should we look into this further? Signal 7, exhaustion that sleep doesn't fix. We all have tired days, but there's a difference between feeling tired and feeling like your body has run out of fuel, no matter how much you rest. If you're sleeping a full 8 or 9 hours and still waking up exhausted, if simple things like walking to the mailbox or carrying groceries suddenly feel like a much bigger effort than they used to, that's worth mentioning. Ordinary tiredness usually has a clear cause and a clear fix. If rest stops working as the fix, that's the detail worth sharing with your doctor. Signal 8, changes in your stool. This one's harder to talk about, but it matters. If your stool becomes pale or gray instead of its usual brown, looks greasy or oily, floats instead of sinks, and has an unusually strong smell, and this lasts more than 2 weeks, it's worth a phone call to your doctor, not a wait-and-see approach. This pattern often points to your body having trouble digesting fat properly, which is something worth checking directly. Here's the part one thinks matters most. Knowing these signals is only half the job. The other half is knowing how to talk about them so you actually get heard. When you go in, don't just say, "I've been feeling off." Be specific. Write down each symptom you noticed, when it started, how often it happens, and whether it's getting worse. Then read that list out loud to your doctor, exactly as written. If your doctor seems ready to move on without further testing, it's completely reasonable to ask directly. Given these symptoms together, would imaging, like a CT scan or ultrasound, make sense here? That's not being difficult. That's being an informed patient, which is exactly what you should be. I want to be really clear about something. Noticing one of these signals on its own is usually nothing to worry about. These are common experiences, and most of the time they have simple, ordinary explanations. What matters is paying attention to patterns, several signals showing up together, lasting longer than they should, or not responding the way you'd expect. That's the information that helps a doctor know where to look. Being informed isn't the same as being anxious. It's the opposite, actually. It's what lets you walk into a doctor's office calm, clear, and prepared, instead of unsure of what to say. If this helped you understand your body a little better, give it a like. It helps this information reach another senior who might need it. Subscribe if you're new here. Every week, I cover health information that genuinely matters for people over 60. And if someone you know has been brushing off an ache or a pain, send them this video tonight. You might be giving them exactly the nudge they need to ask the right question at their next appointment. Take care of yourselves, and I'll see you in the next one.